Good afternoon. My name is Kristen Alcamis. I'm a senior orthoptist at Sheikh Khalifa Medical City, and today I'm going to talk to you about how to examine the uncooperative child, something I'm sure all of you have experienced. What should you do when your child is screaming and crying from the waiting room? It's not the start you really had hoped for. I usually ask the caregiver, why is she or he crying? That can give you some insight as to why the child is so upset. As with most busy practices, we don't have a lot of space or separate waiting rooms. And often the child who just got burning eye drops is crying and screaming, and we ask them to wait to dilate in the same waiting room as the new patients waiting to be seen. This can terrify our new little patients. Add to that a new environment with unfamiliar people in white uniforms or coats who have often inflicted pain upon them in the past. Asking a few questions can often obtain a good examination. Once I had a 4-year-old who was referred by a general ophthalmologist who claimed the patient was very cooperative. He was anything but cooperative. The father was confused as to why the child wasn't speaking. It turns out, on the way to me, the child fell and hit his head. This little piece of information dramatically changed my approach to the child, and I managed with a lot of patience to complete the eye exam. Almost every child asks me if I'm going to give them the dreaded shot or IBRA. Most of our patients have more than one appointment in a day. Hopefully, ophthalmology is the first appointment before the painful, scary needle. You're not going to get an accurate exam out of a child who's sick or has a fever. It's always better for you and for the child to reschedule these appointments. Obviously, if the child is tired or forced to wake up, they'll be more irritable and difficult to examine. I often ask parents to schedule their appointments around nap time. If time permits in your schedule and the parents are willing, have the child continue sleeping and come back later when they're well rested. The same can be said for hungry or thirsty kids. Encourage the parents to feed the child before the appointment or have a favorite snack available. Having the child concentrating on food or drink can often calm them down or at least stop crying long enough for you can do at least part of the exam. Does the child remember getting stinging, burning eye drops last visit? For our follow-up appointments, this can affect your exam. I know if we're not planning on dilating the child on a follow-up exam, I say to the child right away, we're not putting drops in. Does the child have, if you have a chance to review the chart before the appointment, it's important to know if the child has ADHD or autism. You approach a child with autism or ADHD in a very different way than you would a child without these disorders. Again, if you know the child has a developmental delay, a speech delay, hearing delay, it can potentially save you several minutes when you often only have a few minutes of the child's valuable attention. Parents, caregivers, and siblings can be your best friends or worst enemies. How can they be helpful? They can help calm the child. They can praise and encourage the child. They can guide the child by going first and modeling what will happen. And of course, they can bribe the child with candy, toys, etc. How can they inhibit your exam? How can they obstruct the exam? Here are a few common examples. They talk loudly on their mobile phone and ignore the child. They start taking pictures or videos of the child or you, which distracts the child. They go in and out of the room at times, which scares the child into thinking he or she is being abandoned. They laugh and encourage the child when he or she misbehaves. They think it's cute. They promise the child that he or she can have the toys or tools you're using. They bring in the nanny, a large stroller, and all the siblings to crowd the room and distract the child. And one of my favorites, they believe the vision exam is an intelligence exam, and they get angry with the child when he or she misses or doesn't see a letter. I'm sure all of you have plenty more to add to this list. Armed with all this information you can gather ahead of time and with all the potential external distractions, how can you get the information you need from this little person? I always try to encourage the parent to put the child in their lap. It helps the child feel secure, and you can communicate with the parent as they're right in front of you rather than across the room. While taking a history, I glance at the child, but focus mostly on the caregiver or the parent. If the child is still crying uncontrollably, I abandon talking and pull out my fun, flashy toys or a mirror. Seeing a toy or their own face in the mirror often jolts the child from crying. If that doesn't work and the baby's still young enough, ask the parent if they have a pacifier or a bottle. Plug them up. Use a loud voice to shock the child. Using a loud voice and moving about the room usually confuses the child enough to stop crying and look at you. You're doing the unexpected, so they need to keep an eye on you. Burst out in song, sing happy birthday, distracts the child into thinking, wait a minute, maybe this is supposed to be fun. Alternatively, you can use a very soft voice or a whisper. You can hear the most interesting sounds and noises coming from the PD ophthalmology clinics. I tell all the new residents, don't be afraid to sound foolish. Children love playing, and they'll be more cooperative if they think it's all in fun. Use a video or pictures on the parent's phone or iPad to use as a fixation target. Children of this generation always have a favorite video, especially if it's a video of themselves or a sibling. Stay at least a meter away from the child. Once the child realizes that you are not going to touch them, they usually calm down enough for a quick exam. Use your own bribes. I promise cute stickers. Others in our department use toys or candy. When you are out of ideas and nothing is working, the child is crying uncontrollably and the parent has possibly driven from a long distance, ask the parent to take the child out of the clinic and try to calm them down. Often the second time around, the child is tired out from crying and the parents have had the chance to try to calm the child and explain why he or she needs to cooperate. If you've come to the realization this is just not going to happen, focus on the most important part of the exam. Can the baby see? What is the visual acuity? Do the glasses make the eyes straight? Do I need accurate strabismus measurements for surgery? Do I need an IOP? It might take more than one appointment to get a complete exam. Last but not least, if everything you've tried is not working, and as a last resort, knowing it's going to be stuck in your brain all day and possibly all night, I apologize for this, but Baby Shark. Thank you.